We're talking with Nancy right now about the Republican attacks on Medicare, the Republican war on Medicare, their drive to destroy Medicare. Nancy, some people might think we're overplaying it a little bit. So I just want to read a quote from Mick Mulvaney, who is Donald Trump's pick for the OMB, the Federal Budget Office. And he said it very, very succinctly. We have to end Medicare. That's what they're trying to do. They're trying to end Medicare.
That is exactly right. And now, Alex, as you know, I have been working on Social Security and Medicare for 40 years, since the 1970s. This is the greatest threat to both programs I have ever witnessed. And I've written a history of Social Security, and this is, again, the greatest threat.
That book is The Battle for Social Security. You should read it. It is literally the book on Social Security. You can find it at our website, socialsecurityworks.org. So when Medicare was enacted in 1965, it wasn't out of like the goodness of our hearts, right? It was enacted, it was put into law because there was a problem.
Exactly.
There was a problem that people over the age of 65 were seen as uninsurable by the private health insurance industry, who would look for any reason, legitimate or illegitimate, like Donald Trump's presidency, to throw these folks off of their health insurance, to deny them health insurance and leave them to die if they got sick. Medicare was enacted as a solution, and it continues as a solution today. I'm taking this from some of your words, so I know you know this, but there's this myth out there that we can't afford it, that we can't afford Medicare. When Medicare was enacted, our GDP was $4.1 trillion. Today, it's $16.7 trillion. We are far richer today than we were when we created Medicare. The only thing we can't afford is to destroy Medicare or even to keep it where it is right now. We need to expand Medicare.
Exactly. You're exactly right. Medicare, there's an even more basic problem. The problem that Medicare addresses is the inability of seniors and people with disabilities to be able to afford any kind of health insurance. But there's a problem nationwide that's been long recognized, and that is that the ability to get health care should be a right of citizenship. This is not, or simply a right of being a part of this country, citizen or not. That we're not a society where we want people to be dying on the street. We want them to be able to get health insurance. We are the only country in the world that has this kind of hodgepodge system with a for-profit motive in the private sector health insurance. So starting really with way back with Teddy Roosevelt, there were efforts to get universal health insurance. President Franklin Roosevelt pushed for that. President Truman pushed for that. But it kept getting blocked by the kinds of people who want to destroy Medicare today. So the Lyndon Johnson, the legislative genius that he was, said, well, let's start incrementally. Let's start with the most expensive part of the population that is going to be the hardest to insure, those seniors and people with disabilities who have disproportionately high health care costs. Let's make sure they are taken care of. And expanding out is simple, because covering all children is relatively inexpensive but provides a lifetime of health. So with the social,
which just
Medicare
there, Nancy, let me point out for folks, when the idea when Medicare was created was to immediately or very shortly thereafter follow it with a program, something like MediKids, which would cover all kids, all children in the U.S. And then you'd have Medicare, which covered older Americans and those with disabilities, and MediKids, which would cover children. And then you could expand those programs. You could lower the Medicare age. You could increase the MediKids age, and you could meet in the middle. But you could do it incrementally with the goal of covering everyone under Medicare.
Exactly. And even if for those people who don't want to have a universal system. We should definitely be lowering the Medicare age from 65 to 62. We can now start getting our Social Security benefits at age 62. It makes sense that we also get our Medicare then. Paul Ryan and his Republican colleagues want to do just the opposite. They want to raise the Medicare age before they completely eliminate it for everyone.
So massively popular idea, lowering the age, expanding Medicare by lowering the age from 65 to 62. That's not popular with just liberals or Democrats or progressives. Super popular with Republicans, independents, doesn't matter political affiliation. If you're American and you get asked this question, Medicare, super popular. And when there is criticisms of Medicare, it is always in the things that it should do more. It should cover more people. It should cover more things. And that's the direction that the American people want Medicare to be going. And Paul Ryan, Mitch McConnell, and his band of deplorables and in the Congress are trying to drag it the exact other direction. Nancy, because you're on the line with us, I want to delve slightly into policy, a little bit into policy, and then I want to get to the fight back. There's a huge amount of propaganda attacking Medicare, attacking Social Security, a well-coordinated, well-funded propaganda, because it's incredibly lucrative to keep the broken healthcare system that we have. Social Security, it's easier to see because it is more universal and full. Social Security's administrative costs are 1%. 1 penny of every dollar that's paid in premiums goes to administer the whole thing. 99 cents of every dollar comes back to us in the form of benefits. Wall Street sees that and they're like, that is a missed opportunity. They would crack that system open. They would add on at least 25% more administrative fees so that they could buy more golden helicopters to fly out of their golden yachts. That's why they love the broken healthcare system. That's why Big Pharma loves the broken healthcare system we have, to just jack up the prices whenever they want, quarter after quarter, to get their executive bonuses. But I want to go into the propaganda, because what they say is America's aging population means that Medicare is demographically doomed.
Yeah, and what they completely misrepresent, it's not that they misunderstand it, I think you're right, that they willfully misunderstand it, they misrepresent it, is that we have such high healthcare costs in Medicare because we have high healthcare costs in the private sector. Our healthcare system, private as well as public, is growing at very, very large rates. And Congress ties the hands of Medicare. Medicare cannot negotiate for lower drug prices the way the Veterans Administration does, because they want it to appear to be a broken system. In fact, it is not the aging of the population, but the cost of health care that's the problem. And one example is, look at Japan. Japan has a much older population than we do. 23% of the Japanese population is over age 65. We're not going to reach that level of our population being aged until 2050. And yet they spend about a third on their health care costs than we do. And the average life expectancy in Japan is almost 5 years longer than that of ours. So we are spending much more money. We have a less senior population, and our outcomes are worse. The problem here is that we have an inefficient private sector, for profit. I shouldn't say it's inefficient. It's extremely valuable for those who run it, but for the rest of us, it is extremely costly. And
I want to push on that point. I get corrected a lot, and I should. I'm wrong. I get corrected by folks because I say broken healthcare system, and they think that is being too generous, and I join them in that. I shouldn't call it broken. It works perfectly to do what it is set up to do, which is loot the American people, which is to keep the American people sick so that enormous profits, basically unimaginable profits, continue to flow into the pockets of pharmaceutical executives, of big insurance executives, of big hospital executives. This is a system that works exactly what it's designed to do, which is to keep the American people sick and to keep the American people's money flowing into the pockets of these paymasters. And that's why they're incredibly scared of our plan to fight back.
Yes, and in fact, during the Great Recession, 2007, 2008, the one part of the economy that kept growing was the healthcare part, with disproportionate amount of money going there. And it's, other countries have free medical school, free college, free medical school, all of that. We could pay for all of that easily if we did not have so much money going to the drug companies and to these CEO salaries.
So I want to talk about how we're going to fight back, Nancy. So I think most of Tom's listeners are well aware of the battles that you and I fought against attempts over the last 6 years to cut and destroy Medicare and Social Security under the guise of austerity. And there were 6 fast-track attempts, and starting with the Bull-Simpson Commission, the BS Commission. And, under your leadership and this vision that we had to fight back against these attacks to destroy Social Security. But to do so, we had to hold in mind, we had to always have a clear goal of what we were fighting for, which was to expand Social Security, to increase benefits for people and pay for it by making millionaires and billionaires pay the same rate on all of their income, just like the rest of us. And that is what we have to do as we defend Medicare. We have to hold in mind our goal, our vision for what we are trying to build, and expand Medicare with a goal of covering everyone.
Exactly. I mean, this is really austerity on steroids, except it's not really complete austerity, because you'll see much more money going for military. Donald Trump's already talking about a new nuclear expansion, talking about the huge tax cuts for those at the top. Those are already on the agenda, but there is a target on Medicare, on Social Security, on Medicaid, on all of the domestic programs and what we've got to do is fight back, because that's not what the American people want. This is a bait and switch. This is the Republicans running on, we're going to get you jobs, we're going to bring back jobs, and oh, by the way, we're going to get rid of Obamacare. And what they're talking about doing is getting rid of Medicare. No one voted to destroy Medicare. And so as you say, Alex, we plan to fight, and I can see the Democrats are now ready to fight to protect and expand, not just protect, but we've got to protect and expand Social Security and Medicare, build on the successes that they are.
And these are extremely popular ideas, protecting and expanding Medicare and Social Security. We have to just make everyone understand on what side people are fighting for. So this is not a blue state or red state thing. In Mississippi, it is just as popular to expand Medicare and Social Security as it is in Massachusetts. So we have to get the word out across the country.
And here's the hard part, that the Republicans who want to destroy Social Medicare are not going to announce it. They say, we're trying to save it. And they will also do it behind closed doors. They'll try to peel off 1 or 2 Democrats so that they can say it's bipartisan and no one knows who to blame. So people have to be really vigilant. The question not is who's going to save Medicare, because everybody wants to protect Medicare and it doesn't need saving. Say it's a solution. The question is who wants to expand Medicare and who wants to cut it.
And
that gets the question.
And that's the kernel of the strategy. That's what we did on Social Security. In the final minute here, Nancy, what we want to replay is once you understand who is fighting to expand Medicare, you understand whose side the politicians are on, because the Republicans will not get on board with expanding Medicare, lowering the age from 65 to 62. And we need to expose them for that. We need to raise our voices around the country. So, Nancy, in the final 30 seconds here, take us out of the break about where can people go to find more information about this campaign.
Well, I urge everyone go to socialsecurityworks.org, and we will send email blasts that let people know, won't cost you anything, but let people know exactly what's happening. We're following this as closely as we can, because this is something that really is about the heart and soul of this country. This is not a question about can we afford it. This is a question about values and what kind of country we want.